Dear Chairman and colleagues, today I would like to present you off-label uses of vitamin D treatment in dermatology as review. Vitamin D was discovered first time in 1922, and most important functions of vitamin D are bone mineralization, absorption of calcium from intestine, and prevention of rickets. It's known as vitamin D3 from animal origin, and it's synthesized from 7-dehydrocholesterol by action UVB on the skin. And active vitamin D occurs by hydroxylation in liver and kidney. And then active vitamin D binds serum proteins and reach target tissue. And target tissue has vitamin D receptor gene. Vitamin D has three analogs for topical form, that are called tocilstol, calcipotriol, and mexicalcitrol. They have been found effective in psoriasis because of inhibiting the proliferation and regulating the differentiation of keratinocytes. And many skin diseases have a similar pathogenesis with psoriasis, and in this presentation, using of vitamin D in skin disease other than psoriasis is demonstrated. First of them is vitiligo. In vitiligo, 4 randomized control studies were determined. In 2 studies, PUVA treatment and PUVA calcipotriol combined therapy were compared. Calcipotriol was applied one side of the body of vitiligo patients who treated with PUVA. And as a result, at the end of the study, combined therapy given site was improved completely in most of the patients. And the other one, calcipotriol, betamethasone dipropionate, and combined therapy were compared in 49 vitiligo patients. And proportion of healed patients were 6%, 13%, and 26%. Tocilstol and tocilstol narrowband UVB combined therapy were compared in another randomized control study, and combined therapy given site shows significantly higher repigmentation than the other side. And in this picture, left elbow treatment with tocilstol and narrowband UVB, and right elbow narrowband UVB alone. And as you can see in the table, there are many studies, comparative and uncontrolled studies about vitamin D treatment in vitiligo. Some of them it's effective, some of them are non-effective. And keratinization disorders. 1 randomized control study was detected. 67 patients with various keratinization disorders were treated with calcipotriol ointment twice a day during 12 weeks. Especially patients with ichthyosis improved significantly. And there are many case reports in literature, such as porokeratosis, Derrier disease, Grover disease, and tumoral disorders. In a comparative study, calcipotriol and tretinoin cream were compared in 40 patients with oral leukoplakia. And 5 weeks later, 2 treatments were shown similar efficacy. And 80% of patients were improved completely in both groups. And the other one, calcipotriol, was given 2 patients in 2 case reports. One of them was a 13-year-old girl with nevus comedonicus, and the other one, 69-year-old woman with epidermodysplasia verruciformis. And 6 months later, both of lesions were regressed significantly. In this picture, lesion of patients with epidermodysplasia verruciformis and after treatment. And also, there are some case reports about acanthoma, Bowen disease, and sclerodermoid disease. In an uncontrolled study, 3 patients with scleroderma were treated with oral calcitriol, and 6 months later, clinical improvement was detected. And in 2 uncontrolled studies, calcipotriol treatment was given patients with morphia. At the end of the studies, lesions improved significantly. In these pictures, you can see morphia lesions before and after treatment. Before treatment, atrophic telangiectatic plaques on the left arm, and after 3 months of treatment, plaque regression and slight pigmentation. And the other studies. And let's talk about the other disease. And first of them, I'm going to start with prurigo nodularis. In a randomized control study, 10 patients with prurigo nodularis who didn't benefit from topical corticosteroid were treated with calcipotriol. And 8 weeks later, size and numbers of nodules decreased markedly than betamethasone. And the other one, polymorphic light eruption. In a randomized control study, 13 patients were treated with calcipotriol or placebo on their 2 symmetrical array. Photoprovocation tests were given to the patients. At the end of the study, calcipotriol given areas lesions dependent with polymorphic light eruption regressed significantly. Atopic dermatitis. In another randomized control study, 107 children with winter-related atopic dermatitis were treated oral vitamin D once a day for 1 month. And 1 month later, there was a clinical improvement significantly. And there is a lot of disease, dermatological disease about vitamin D treatment. Erythema centrifugum, viral warts, xerosis, Hailey-Hailey disease. Viral wart before and 4 months later from treatment. And in this picture, Hailey-Hailey disease before and after 3 months treatment with tocastol. Vitamin D is given to patients with psoriasis because of inhibiting proliferation, stimulating differentiation of keratinocytes. Also, vitamin D stimulates melanocytes and melanin synthesis. So, it was shown in various randomized control studies that vitamin D analogs highly effective combination therapy in vitiligo, but it's not effective to treat vitiligo patients with only vitamin D analogs. In a lot of skin disease, topical vitamin D can be useful, like psoriasis, because of regulating keratinocytes. But vitamin D can be also given in other skin disease due to effect with other mechanisms. Some examples of those mechanisms are in xerosis, increasing filaggrin expression; in Hailey-Hailey disease, inhibiting acantholysis by transactivated integrin gene; in sclerodermoid disease, inhibiting proliferation of fibroblasts. As a result, vitamin D can be useful in a lot of skin disease other than psoriasis because of various mechanisms of effect, but it still required more and comprehensive study about using vitamin D in various skin disease. Most of studies are as case reports. And thank you for your kind attention.